and good evening. Welcome to another episode of HealthWise. I am your host, Dr. Monique Lescott, in collaboration with ZIZ and the St. Kitts Nevis Medical and Dental Association. I am here with my lovely guest. I'm sure you guys would have met her before on previous episodes of HealthWise. My guest this evening would be Miss Clilia Davis, and we have a very jam-packed HealthWise episode for you this evening. Our topic for this evening would be breast cancer awareness, statistical, biological, and the importance of translational research. I know that was a mouthful, and our lovely Clilia Davis is here to break down all of those words, those heavy research-laden words. She's going to break it down for us to a more palatable portion that we can swallow. Welcome tonight's guest for me, Miss Clilia Davis. Welcome.
Thank you so much. It feels a little bit strange being on the other end of the spectrum, not being a host, but I think it was very timely for me to be here as a medical scientist and specifically majoring in breast cancer research.
I had no idea.
Yeah.
So how did that go? You have to tell us how many years did that take?
Well, started out research in undergraduate, but that was with sickle cell disease primarily. But then I did most of my graduate work in Taiwan, and that's where I did oncology work in breast cancer research. So it took about 2 years.
Wow.
Yeah.
Wow, that's very interesting. I'm happy that we can have your expertise on the show then. So break it down for us. I guess everybody has heard of breast cancer before, and just for those of us who might have heard the term, but we're not sure exactly what it entails, what it means, break it down for us. Exactly, what is breast cancer? What is it about?
Okay, so breast cancer is essentially the malignancy of breast tissues. So when I say malignancy, another word...
Yes, another big word. Break it down for us with the medical jargon. What does malignancy even mean?
That would be something that is cancerous. A tumor, a group of cells that essentially keeps growing. They're immortal because typically in our normal functions, we would have cells that are supposed to have a certain shelf life, but when it comes to cancer or malignant tumors, these cells just keep growing and growing and growing, and there's no end in sight, and then they cause a lot of debilitating issues, what we know as cancer.
Okay, so when we have those malignant cells in the breast area, I guess it can occur in any part of the body, but specifically we're speaking of breast cancer tonight. So we're speaking about when those cells now become malignant in the breast tissue.
Right.
Okay, so we're going to take a short commercial break, and when we come back, we're going to delve deeper into this topic.
Smart Electronics, your one-stop shop for all your electronic needs. Unlock cell phones, tablets, laptop computers, Bluetooth speakers, TVs, mobile accessories, memory cards, USB drives. We carry all major brands. Now you don't have to go anywhere anymore. Everything's available under one roof. Smart Electronics at Port Sante opposite the food court. Telephone 466-4271. Visit our website at dutyfreesmartelectronics.com. Smart Electronics, way to live a smart life.
The stage is set, the spotlights are on the contestants, and the mic, it's hot. It's the ZIZ Kitchen Superstar 2025, the island's biggest and most exciting sing-off competition. Coming to you live every Thursday at 8 p.m. on ZIZ Television and across all ZIZ social media platforms. Each week, the performances gets bigger, the voices get stronger, and the excitement reaches new heights. Follow the drama, the emotions, the music as our stars chase the crown of Kitchen Superstar and avoid elimination. Tune in every Thursday at 8 p.m. on ZIZ Television and ZIZ social media platforms and cheer on your favorite contestants. ZIZ Kitchen Superstar 2025, the journey to stardom.
And good evening. Welcome back again to another episode of HealthWise. I am your host, Dr. Monique Lescott. I am here with the lovely Clilia Davis, biological scientist.
Medical scientist.
Medical scientist, sorry. I said that wrong. And our topic for tonight is breast cancer awareness, statistical, biological, and the importance of translational research. And just a quick disclaimer, the information in this presentation should not be substituted for medical advice from a licensed physician. Please contact your personal physician for health care and medical advice. This is intended for educational and awareness purposes only. So we continue into our discussion. Where do we begin?
So the biology of breast cancer.
The biology of, so can we have this slide? The biology of breast cancer so we can discuss. Yes. Let's go.
So when we think about the development of breast cancer, there are certain risk factors that could attribute to this. One of the most known one would be genetic mutations, and then that would now manifest into a tumor, and that is the collection of overgrowing cells that won't die. And then we actually have different types of breast cancer, which I would explain in the next slide. But when we talk about place of origin, right, this is where the cancer will start, but then there are also places where the cancer could spread to, and that is now called metastasis. Right? So firstly, you would have what we call a local invasion. That's where it starts out. And then you could have invasion of the lymphatic system. So you would go to lymph nodes. So particularly with breast cancer, some of those lymph nodes underneath your arm would start to get inflamed and infected. And then if it goes through to the bloodstream, this now would cause the cancerous cells to venture to other organs in the body.
And I must say, like, because your bloodstream and your lymphatic system is a drainage system, it's like a system like a where highway. You have, that's a good way of putting it, it's a highway where you have heavy traffic moving from one bodily system to the other, because I think sometimes that's where the confusion comes from, like, how is it spreading? One of the main ways it spreads is through your drainage system, which is your lymphatic systems, and your bloodstream. That's like one, two. Those are two ways it spreads.
Yes. So then, for instance, with breast cancer, some common metastasis sites would be the bone, the lungs, and the brain. So no, we would stage that as stage 4 if we realize that those cells that would have come from the
original mutation sites would have been like the bone marrow, you mean?
The original mutation would have happened in the breast.
In breast.
Yes, and then those cells now would have traveled to distant organs, right? And that's where now we talk about metastasis. But just stepping back a little bit so we could understand the types of breast cancer, we have luminal A, luminal B, HER2 positive and triple negative. What does this mean essentially? No, on
we have to take this slow.
Yes.
You're talking so fast. You have to take this one slow for sure.
No problem.
The HER2, I actually did some work on the HER2. That was an interesting one a few years ago. And they had some new medication developed for this one. So you have to go slow.
No problem at all.
Remember, I'm older.
And for our viewing audience, I really want to make sure everybody understands the interworkings. So let's break it down. On your breast cancer cell, there are going to be little receptors, right? And these are what we call hormonal receptors. So we can have, as is mentioned on the screen, we have estrogen receptors or progesterone receptors. Some of those terms may sound familiar. And we were speaking about birth control last week in the last episode, and we know these are some of the female hormones that we have naturally occurring in our bodies. But sometimes on the breast cancer cell, once these receptors are present on the cell and you feed this cell with the estrogen or the progesterone, that causes exponential growth within that subtype, right? Luminal A would have both of those receptors, estrogen and progesterone.
And this would be a diagnostic category based on biopsy?
Yes. And also you can do immunohistochemistry tests. That's
Break it down. You did a what? An immunohistochemistry test?
Yes, it's a type of blood test to check to see what biomarkers are present.
Biomarkers?
Yes, and a biomarker is just a way to measure some normal bodily function or some disease or your response to some sort of treatment. So it's a tool that we use to check,
identify as
and
well,
to surveil. Yes. Right? And so with luminal B, we have also ER and PR, as in estrogen and progesterone positive, but there are some other markers in the play, right? I don't want to go into all of those specifics right now, you know, bearing in mind the mixed audience that we may have. The third one is HER2 positive. However, it does not have ER and PR receptors, but it has the HER2 protein,
Positive.
right? So that is how we're able to identify that one. I must mention as well that about 65 to 70% of all breast cancers are typically luminal A, or you may hear the term hormonal type breast cancer. With triple negative, however, no HER2 positive, no ER, no PR. So it does not have any of those receptors on the cells, the cancer cells. And typically, even though this is less incident, it is the most aggressive type of breast cancer, and it can actually happen in younger populations.
So this is a more malignant one?
More aggressive.
Aggressive?
Yes, and then it could also be malignant if it's not caught early, right? And then the oncologist now would use if we look to the bottom part of the screen, the staging scale.
Staging guides, treatment decisions. Okay.
So there is the tumor node metastasis. So we want to check first the size and the extent of the primary tumor. So that would be at the site of origin, in this case the breast, and that can be scaled from T0 to T4. And then you would have the nodes, which represents the lymph nodes, to see if there would have been any invasion to the lymph nodes, and then also to check if there has been any sort of metastasis. And based on this metric system, the oncologist is able to
Give you a stage, okay.
Stage 1, stage 2, stage 3, stage 4. Stage 4 being some sort of metastasis taking place.
And stage 4, I guess, would be the most serious.
Yes,
And
most
I guess
definitely.
I would, in some cases, stage 4 can be the terminal stage, palliatives.
Yes, and that is based on access to treatment that is available, the type of cancer, the place that it would have ventured to. So a lot of the times, you know, you really want to enforce precision within the staging, the diagnostics, the treatment, but we're going to get into all of that. I don't want to have information overload too much.
I got you, and we're going to definitely get back to the presentation. We're going to take a few short commercial breaks, and we'll be right back.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing. But hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para cortar la humanidad. And I must leave no one behind because we are. One climate, one Caribbean. One climate, one
Welcome back, everyone, and my name again is Dr. Monique Lescott. Our topic for tonight is breast cancer awareness, statistical, biological, and the importance of translational research. I have here with me Miss Clilia Davis, scientific researcher. She came here to make a presentation on breast cancer. So we'll continue. We at the global statistical landscape. We're gonna.
Yeah, sure. So I think a lot of the times when we talk about diseases, it doesn't really hit home until we see numbers, right? And how those things affect us. So in 2022 alone, there were 2.3 million new cases, or we can say the incidence of breast cancer globally, and just under 700,000 deaths. Now, if that doesn't make you go, oh my God, then I really don't know what will. So here, what we're trying to show, we have 3 different bars in terms of the diagnostic risk and then the death risk. And so we're going to break it down based on just overall global statistics, and then also the high human development index and low human development index. That's what the HDI stands for. So essentially, when we talk about human development index, it refers to health, the knowledge of a community or country, and also the standard of living. Now, if we look at the global stats, we could see that 1 in 20 women, that is a lot. 1 in 20 women will be diagnosed with breast cancer during their lifetime, and 1 in 70 will die from it.
Wow.
Right? However, in high HDI or human development index countries, 1 in 12 women will be diagnosed, and then 1 in 71 women will die.
So it's a standard of living type of situation.
Yes.
And I guess access to nutrition and different
and
lifestyles.
Care, right? And the financial aspect of it too, because now you could realize with the low HDI countries, 1 in 27 women will be diagnosed, but then 1 in 48 will die. So we can see that grave disparity taking place.
So what is an example of a high HDI country?
Like a developed
a third world country?
Like
No, we're
UK,
not supposed, we don't like saying those words.
Developed versus developing, and but we get the point. So one of the key insights here is that there's a significant disparity in breast cancer outcomes based on the country's HDIs. So it really highlights the inequities to access, as you were talking about, and to also early detection, because in a lot of places that don't have the resources to do the early detection or the diagnostics, and then also have the treatment modalities.
Which is actually quite expensive.
Yes.
Oh my God, I just got access to the costing of some, even just a single dose of a medication can be upwards to like $1,500 sometimes. And so that's just one single dose, and so you need more than 1 dose for sure per month. So that money can really rack up very high.
And very quickly too, right? And then, you know, when you don't have that help, if you're doing this on your
assistance
own,
is,
you know, it's really, really debilitating.
That's why so many organizations pick up with the research and the funding and the fundraising, because those persons who are victim of the illness, they're really at a loss. They really do need assistance, because, I mean, who's going to have 50 grand just there for medications alone, and that's just for medications alone. That has nothing to do with just your cost of living, your living expenses. That's just for the medication. It's really difficult.
It is. If we take a look now, though, to the Caribbean context, we can see if we yes, launch the slide for Caribbean context for me, please.
No, the other,
Yeah, so just under 15,000 new cases in females, and I mention in females because men can also get breast cancer.
We'll stick a pin on that, because that was quite interesting for me to learn.
Yes. And there was just about 6,000 deaths in the Caribbean region alone, right?
For men, or just that's in general?
Sorry?
That's for men?
Females.
Females, okay.
Yes, in females in 2022. If we look at the numbers, 15,000 to 6,000 deaths.
Yes.
We can see that it's almost about half,
yeah.
right? And that is something that we definitely would want to lower.
So it's basically a 50-50 chance of survival once you're diagnosed, almost. That's basically what the statistics is suggesting.
Correct. If we go to St. Kitts and Nevis now, we know that we have some increased risk factors based on some information from PAHO. We have a high percentage of obese populations. We also have persons not really exercising and also
they live in a sedentary lifestyle.
Yes, they're intaking
because
a lot of alcohol too.
even if you don't exercise, if you lead an active life, for instance, if you walk a lot, just maybe to and from work, or if you have a job that you have to be moving about, then that's different. But I think a lot of us, we have these office.
We sit behind our desk.
Yes, we want to be cutesy. We have to have our nails done. And so we don't do a lot of physical activity like before.
And it's extremely important. Now, coming out of the Ministry of Health, these stats are from 2025. In Q1, there were 20% of breast cancer cases in terms of the total amount of cases. And in the second quarter, we had 28.6%. So we can see that breast cancer sometimes is either number one or at least really close behind prostate cancer. So just to stick a pin, the three main cancers that we see here are breast, prostate, and colon cancer. Those are the three highest.
And all of them are actually linked to lifestyle.
Yes.
Actually.
Most definitely.
If my memory can serve me correct, all of them have a lifestyle linked to it.
Yeah, so we really need to pay attention to why all of these things are happening at the rate that they are happening. But there is hope, because we can see that through research and continuous learning, even from our physician staff, things are on the horizon, right? I also want to shift a little bit from the stats and the biology to talk about the mental health impact.
We're going to stick a pin on that.
Okay.
That's actually quite a big topic, I could only imagine, because
Yes.
I mean, any terminal illness or any illness that brings so much added stress with it definitely is going to have a mental health component to it.
Correct.
So we're going to just take a few short breaks and we'll be right back.
Okay.
Yeah, man. Another day in the books. Well, hello there. Ooh, she pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
Good evening and welcome again to this week's episode of HealthWise. I am your host, Dr. Monique Lescott. I have with me Miss Clilia Davis,
Medical scientist.
Medical scientist. I keep forgetting that part. The medical scientist. Our topic for this evening is breast cancer awareness, and we're basically discussing the statistical, the biological, and the importance of translational research. Before we left for our break, we were introducing the mental health aspect of the illness. So I'm going to allow Ms. Davis to elaborate on that.
Sure. So let's break it down and then we'll build it back up. Now, sometimes when we have the immediate intervention, meaning either surgery, chemotherapy, radiation, whatever that treatment regimen is. Specifically when it comes to surgery, there's a lot of differences, of course, physically that your body goes through, but you could imagine having a mastectomy, which is the removal of the breast, right? And you look at yourself in the mirror as a woman and it's like, where did I go? Like, what happened to me? You have that sort of post-traumatic stress disorder. It could make you depressed. It could make you distressed. You start to have body image and even sexual dysfunction, right?
It's important that you have fundamental support too, like family support, spousal support, because I've known of some situations where the person is already, as you said, they're going through body image issues, and sometimes I think the family takes that for granted. Definitely takes a toll on your self-confidence.
No, both of my grandmothers had breast cancer and has since now passed, and both of them had a mastectomy. My oldest, yes, because she was actually older than the first, my mother's mother, she was 89 when she was diagnosed with breast cancer. And
wow.
Yeah.
Very late diagnosis.
Very late. And so I believe one of her risk factors would have been age, because that's one of them as well. As we age, mutations would become more rampant. So even at 89 years old, she had the mastectomy.
Oh.
And I mean, for her, it was like, okay, well, it has to happen, you know, if this is going to save my life. And she was just very nonchalant. She took it in stride. But that is not the case for everybody.
Everybody, yes.
Especially a younger woman who hasn't essentially lived life as yet. And younger women are getting breast cancer more often, right? We may not see it particularly here in St. Kitts and Nevis, but the incidence, the age is getting younger. And we start to ask ourselves, why is that? And as you were mentioning before, lifestyle choices, even your genetic markers, because we need to know, check to see if there was a primary relative like your mom that would have had a breast cancer diagnosis, and then that would be the push that you need to go and check at an earlier stage, especially if she was diagnosed at an earlier age. And the microenvironment that we live in, right? Pollution, the sun, I mean, in terms of skin cancer, all of these different things manifest. And once we have an inflamed body, that is,
I think we take for granted when we hear about carcinogenic foods. I think carcinogenic foods are a big culprit. A lot of the processed foods that we really love, the processed, the hams, the sausages, a lot of these smoked those smoked and processed stuff, foods, they get a really bad name, but we love them, and I don't think there's a lot of policing about it. I think people take it for granted.
You know what I realize? We speak about nutrition and how good it is. It's good to have a balanced diet, and it's good to maintain a healthy lifestyle via exercise and all these things. But until we really break down the physiology, and of course in a palatable way, but until we do that, persons are not going to be serious about it. Because even, as I mentioned last week, like, I'm saying all of these things as a sounding board for myself, because I have to check myself sometimes and say, oh no, Clilia, no, put that back. Don't eat this, you know, you're about to go to sleep. Eat some fruit. And
the sugar is also a big culprit. The sugar and the carcinogenic foods, the processed stuff, plus the sugar, I think it's a really bad combination, plus the salt.
You mentioned sugar, and that is a very, very big one. The cancer feeds on sugar.
Yes.
Right? That is the bottom line. No, there must be a fuel, even though these cells have now cheated the genetic code in order to, and the cancer cells, what I'm talking about, in order to just perpetuate and live forever and ever, essentially, right? and they need a fuel to be able to do that. And sugar, glucose, is that fuel. And if we decrease, or I mean, it's not practical to say completely eliminate it at all times. You have to be practical here, and then you have to also wean yourself off and do things in moderation.
I don't think sometimes a lot of persons know what the regular intake per day is when it comes to sugar. Like, for instance, if you pick up a bottle of soda, the grams, the amount of sugar for that bottle is like 33 grams.
60 grams
And
in a 20
you're only
ounce
really
bottle.
supposed to be allowed 40 grams of sugar per day. So then if one drink has more than the amount of the allotted amount of sugar that you're supposed to be having per day, first of all, you're making your organs of elimination work overtime to get rid of all of this sugar. And I suspect that's how come we have so many other non-communicables happening, because
Correct.
we're not looking at our portions as we should. We are over sugared. I think most of us are in a sugar coma and we don't know.
Yeah, and as we were mentioning as well, when you have all of this sugar inside your blood, and you tend to get insulin resistance after a while. What does that mean? Insulin resistance, insulin first is the hormone that is going to pull the sugar out of our bloodstream so that it can go into our muscles and
For
into the
energy
cells
and whatnot.
for energy. Because at the end of the day, we are human beings and we go through a cellular process where we use glucose or sugar to give us energy, right? And that currency is called ATP. Just a little science nudge for you guys. And we want to be able to get that sugar out of the blood as quickly as possible, to use it as efficiently as possible. However, if you're going to be bombarding your body with sugar day in, day out, all the time,
I think the
during day,
pancreas just gives up.
the pancreas now has to secrete insulin in excess amounts, and it's like, okay, the pancreas is normally secreting this amount, but in order for me to have this effect, I need to secrete even more. Right? And so at a point now, you tend to become
Resistant.
insulin resistant, and that now would have a cascade of events because of all the things that are happening in your body. Your tissues become inflamed. Inflammation is like the best environment for any of these NCDs to thrive, autoimmune diseases, all of these things. So once we really break down what healthy eating and also good exercise, a great lifestyle, holistic lifestyle, what those things are and what they do, because I think we stop at, you should do this, and that is it. But why? Why should we do it? Explaining the why, making sure people understand the why is what I think is going to push us over the edge, so to speak, into a much more healthy lifestyle, and to try and prevent a lot of the issues that we see with breast cancer or any other cancer as it relates to that.
I definitely agree with you, but I would tell you this, sometimes getting people to change their habits is one of the hardest things to do as a healthcare professional.
It is.
Because they would tell you straight up that their palate is already accustomed to that amount of sugar. So making this switch sometimes is not an easy task for most persons. So, okay, so we're going to move along. We're looking at the role of, where are we? This is the patient journey to mental health impact. We're going to stay there. Are we moving on?
Yeah, we can move on to the
role of physiotherapy in recovery.
Yeah.
Okay, the key benefits.
So some of the key benefits are managing physical impairments, reducing cancer-related fatigue, and restoring confidence and control.
Explain that one. What is cancer-related fatigue?
No, that is essentially when you have like tiredness
because of the treatment.
Because of the treatment, you know, sometimes, especially when you take these chemotherapies or radiation therapies,
it drains your
energy. Drains you, because you're not only affecting the cancerous or bad cells, you are also, by extension, affecting healthy cells as well. And that is why, for the most part, a lot of the cutting-edge treatment modalities seek to be precise to attack just the cancerous cells rather than
To
all
try
of
and
them.
kill, okay.
Yes. But as it relates to physiotherapy, I think some persons overlook this actually, even when it comes to this post-op or post-operation. You would have to have certain types of rehabilitative exercises, especially if you would have maybe taken both breasts or have a double mastectomy. And we want to be able to reduce or manage the incidence of lymphedema, which is a chronic and one of the most common morbidities after surgery. And this is essentially the swelling, the chronic, have to put that word in there, the chronic swelling of body tissues, right? And this could be very, very debilitating. So physiotherapy, along with whatever medication your oncologist or PCP, primary care physician, would have prescribed, would be able to manage this. And also just your functional rehabilitation, being able to increase mobility, your strength, and your overall capacity to do, your daily life functions. So these are also some of the things that come post-operation or post the immediate intervention that we also have to take into consideration in terms of the financial cost, the mental payload that you have to go through all of these things. You don't feel good at all, but you have to get up and pump some weights, pump some iron, or whatever it is you have to do,
And maybe do some sort of cardio if you can.
Yeah, and sometimes it hurts. But on the journey to progression, we have to essentially condition our minds that this is part of the healing process.
That's something definitely that we need to really consider. It's really an uphill battle. And we're going to stick a pin here and we're going to take a few short commercial breaks. We'll be right back.
Every smile, every hug, every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer, a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
And welcome back. Good evening again. Welcome back to another episode of HealthWise. I'm Dr. Monique Lescott. I am here with Miss Clilia Davis. She's a medical scientist, and she's here with a presentation on breast cancer awareness. The subtopic will be statistical biology and importance of translational research, and that's actually where we're at right now. The translational research aspect of the presentation, the biomarkers, and the precision medicine. So take it away.
Okay. So a biomarker, as mentioned before, enable precision medicine So when we talk about precision medicine, we're essentially trying to make sure that each patient has an accurate and precise treatment modality. First, we have to be able to delineate the type of breast cancer, and then, or the subtypes that we were speaking about before, and then also even a step further to be able to find out what would have been the cause of that specific subtype, whether we look at genetic mutations or epigenetic changes.
Hey,
So-
what is epigenetic changes?
Yes,
Now you
I'm
have
going
to
to
break this
explain.
down.
Yes, I'm going to explain. So everybody knows what genes are, our DNA. It's essentially our instruction manual that makes me me and makes you you, right? And so sometimes we can have changes in that genetic code, and when we have like an amalgamation of those changes in a bad way, that is what would now manifest into the mutations or the genetic mutations. So changes to that genetic code or to the DNA that would have some bad sort of effect. No, that is the code that you are born with. However, epigenetics is the surroundings, the things that would change your phenotype or the
Your
way that
environment,
things
the way how
look.
your environment would interact with
Yes.
you as a human.
Yes, so the way that
Understand.
your environment, and it's not just necessarily the trees outside or the gas that you're smelling, but also the internal environment. What are some of the things that could turn off a gene that is supposed to be on and turn on a gene that is supposed to be off? So those are now the epigenetic changes that can occur within the gene itself.
I would think stress would be a good example of what can cause an epigenetic change.
Yes, and then stress would be induced by some other
Environmental factors,
Yes,
for
environmental
sure.
stimuli, right? So there are a host of them, and perhaps I could have a conversation, a more deeper dive into what are some of those things on a different episode, but. When we have these genetic or epigenetic markers, biomarkers, there are no targets for us to check. Is it this type of cancer? Is this what's causing that subtype of cancer? So again, it's a measurable tool that we use in order to pinpoint that specific bad area, and that is what now we want to eliminate or try to reverse, depending on what it is, right? So we have different types of targeted therapies. So we would have those for the ER, the PR, the HER2, for triple negative breast cancer, because they don't particularly have any of those three receptors on the surface of the cell. We have to use another type of modality, right? Now we also have immunotherapy, where we use our own immune system and basically tell it, go and attack that cancer cell and that cancer cell only, based on some marker that is on the cancer cell.
That's bordering on some stem cell stuff, no?
Not some of the concepts are similar, but essentially you're going to be using your immune cells and also some sort of ligand, like an attachment to that immune cell that is now going to say, okay, I pick up this on the breast cancer cell, so I'm going to now attack it precisely. I'm not going to touch any of the other cells that are good. I'm just going to attack that one.
So that's the basis of the targeted therapy.
Yes, yes. And we have been working on these tirelessly in different labs around the world based on the type of breast cancer. So as you can see here, we have one at the bottom, PDL1, which is an immune checkpoint inhibitor, and that focuses on a triple negative breast cancer. And then also we have some HER2 targeted therapy like trastuzumab, and sometimes, after a while the terms just fly off your tongue. One time my mother was asking me, how do you say those things, those long words so quickly?
You get accustomed.
You get
though.
accustomed,
But I know
right?
this particular drug is really expensive.
Yes.
Really, really expensive. I
It
was really
is.
surprised. It's effective, but it's expensive.
So and then I mean, it makes sense, right? It's effective, so it's gonna be in demand, and once it's in demand, then the price is gonna go up, you know. And a lot of the times as well, we want to be able to find ways and
to cut costs.
Yes, to cut costs.
And one thing we have to remember with our local patients is sometimes even the pharmacy would not necessarily carry the medication that they might necessarily need. They always have to order overseas, which also adds to the costs as well.
Yeah, that's true. We are at a disadvantage here in the Caribbean because we don't have that access to a lot of the cutting edge tools and also the medications due to cost, due to the geographical areas and just a host of different things. But that is why people like us, medical scientists, are here to try and create those new avenues to bridge those gaps, right? If we take a look at what a clinical trial is, clinical trials essentially are the cornerstone of medical advancement, right? This is where a drug will go from the lab, being tested to the patient's body, essentially, right? And there's a process that that goes through. So we're gonna have laboratory research, we're gonna have clinical trials, we're going to have clinical practice, and then improve patient outcomes. But even between the lab to clinical trials and then into the market, that
it takes a while.
It
takes a good while.
12 years.
Oh, I was thinking less.
For about 12 years for any one drug to come to market, right? And sometimes it takes about $2 billion.
Wow.
So that is why a lot of the drugs are quite expensive.
By the time it does get to the shelf.
By the time it does
because
get
of
to
the
shelf.
amount of manpower and,
and
resources that goes into developing the drug.
Correct.
I could see why it would be that.
Correct.
But gosh, I've seen some patients really struggle with the cost and keeping up with the cost of keeping themselves alive. And it's actually a real struggle. It's a test of survival, especially if you don't have, even if you don't have financial support, some of them also don't have familial or community support.
Right.
So it's a very lonely road.
Yeah, and that support system is extremely important.
Yes.
Even if you are a clinical trial candidate, you know, and I just want to mention 2 ongoing breast cancer trials are the Keynote 355 trial, and that is targeting triple negative breast cancer. And then we have the Mona Lisa 2 trial, which targets HER2 and hormonal positive advanced breast cancer for postmenopausal women. So there are lots of different indicators and matrices in terms of what you could do. Sometimes we have trials that have combination therapy, so it uses chemotherapy along with a targeted therapy, or sometimes maybe you're trying to decrease the size of the cancer before you actually resect it or take it away. So yes, you know, there's a lot of different plays because we want to see what would work best for this specific type of breast cancer. So you know, things have gone pretty well in terms of conventional times when we only had chemotherapy
and radiotherapy.
And radiotherapy as some sort of intervention. So the prognosis has increased tremendously, especially in some of the more advantaged countries that have the ready access to these tools. And so we want to be able to bridge the gap here in the Caribbean, because one thing that I must mention is that a lot of, or most of the drugs that we use, the diagnostic tools that we use, we are not a part of these clinical trials. So Caribbean persons with our type of genetic predispositions, our genetic markers, the way that we live, the lifestyle that we live is completely different to patients that you would see in the UK and in the US, but the drugs and the diagnostic tools are being fashioned off of them predominantly. And so even the way that we maybe metabolize or the way that we take in
how we react will be different.
We react to the drugs could be, and most definitely is different.
It's different. So then what do you suggest? How do we go about getting our people on these trials? Like, is it that we have to have more collaborative efforts with the government and overseas bodies? What's not?
So first of all, we have to create a framework of knowing what scientific research is, what a clinical trial is, and that being married to the clinic. We have to, and this is why we're having this type of conversation, so we could now sensitize people to what these things are, why they are important, and how they are applicable to you. Once you have done that, and you feel confident enough that persons are sensitized well, then on the back end, all of the formalities in terms of the ethical standards, all of the institutional review boards, ethical boards, all of these things could start to be manifested. And then we have to now look at the technical part, where we do breast cancer registries. To date, we do not have one.
In St. Kitts?
In St. Kitts, we don't have a breast cancer registry with genomic data, which what I mean by that is that
it would help with the research.
Sorry?
You need like a research pool.
Correct.
So that when you want to do your statistical analysis, you already have a registry with certain base information, so then you don't have to start from scratch every time.
Correct.
I understand.
And you won't be doing things prospectively. You can do things retrospectively, meaning you can look back 3, 5, 10
and
years
see what was the
to
development,
see what the development is,
or lack
any
thereof.
trends, any differences. And I'll give a practical example. Now, with my research that we actually got published, so we were doing liquid biopsies as a detection for breast cancer, early detection, and also as a treatment modality target. And we just took a little blood draw, and we were able to compare the blood from a cancerous patient and also the tissue. We got some good tissue and we got some bad tissue. And then we were able to compare, okay, I am able to see this genetic alteration from the blood test versus the standard, which would be the tissue, because this is what I'm seeing under the microscope. The pathologist would see those specific cells that are malignant, and then also we can do the genetic testing to see what that genetic variation would have been in tissue. That is the standard of care. But then how can we level up, essentially? So we want to know, do the liquid biopsy, because that is much less invasive. It's just a blood draw. It is less expensive. You have a lot less side effects after everything, because to go under tissue biopsy, you have to go under general anesthesia, right? And so with all of these things in mind, we were able to see sensitive and efficient results from the liquid biopsy that were comparable to the tissue biopsy. And so that is now one of the frontiers in terms of the diagnostic tools, response to medication, and also prognostic biomarkers as well. So
then definitely a registry would definitely help for future research endeavors.
Most definitely, and we need it, because then, as I was mentioning, in terms of the lack of this information, and so we are not included in the clinical trials. We don't know what our genetic mishaps are. We are only fashioning what we think it is based on overseas data. And it might not necessarily be the case where that is ours. And so the precision medicine is not apparent. And in order to make that apparent, we have to ensure that our data is represented.
And up to date.
I
agree. We're going to take, sorry to cut you off.
No problem.
We're going to stick a pin here, and we're going to take a few short messages, and we'll be right back.
Every smile, every hug, every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer. a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
Good evening again and welcome back. I am your host, Dr. Monique Lescott. I am here with my guest, Miss Clilia Davis, medical scientist who has stopped by to shed some light on breast cancer and awareness. The subtopic for tonight was statistical biology and the importance of translational research. But unfortunately, we are almost at the end of our show and we're just going to do a quick recap of what we already went through already. So I'm gonna have you take it away.
Sure. So tonight we spoke about some of the intricacies of breast cancer after you would have been diagnosed, how we actually diagnose the types of breast cancer such as luminal A, luminal B, triple negative breast cancer. And you know, we also talked about the things after diagnosis such as the importance of physiotherapy, the importance of a really great support system, some of the things that we overlook in terms of the socioeconomic impacts of a breast cancer diagnosis, the fact that it is an uphill battle, you know, it is a moment to progress, and those persons who are experiencing this ravage on your body, I could only empathize and sympathize as much with you, but I think we're trying to do our best to ensure that you get the best type of precision medicine. And what I want to do here and in other forums is to ensure that we create that awareness of what translational medicine is and how it should be injected in the clinic, why we should be talking about it a lot more in St. Kitts and Nevis, and how it is going to be beneficial to all of us, not just the survivors, but to the persons who depend on survivors, right? And to increase that quality of life. Because sometimes, even as scientists, we talk about 5-year survival rate or overall survival, and we really want to tap into the overall survival rather than just you're gonna live for two months, 3 months, etc. So being able to have and increase that quality of life is the gold standard and is the goal. And in conclusion, I just want to, you know, highlight the challenges that we have. There, of course, global disparities for reasons that we would have mentioned.
Financial
reasons, you know, access to care, etc. And then how translational research really bridges the gap. Even in communities like ours, we can't move forward if we don't start the conversation. So this is the first step. And so I am very determined to keep pushing so that the conversation will continue and that action will be had and had consistently. And I think once we have a real collective action, we understand all of the inner workings and nuances. And it may sound utopic, but it's possible because proof of concept has proved in other countries that precision medicine is the standard. And so we must get there, not if, but when. And so myself as a medical scientist, along with the medical fraternity as physicians, we need to work hand in hand to ensure that we bridge those gaps, because our community is very small, so it is not hard at all, right?
Okay.
And so I think
I learned so much. I really thank you for stopping by, Miss Davis, and
Sure.
for shedding a light and for sharing all of that knowledge that you took your time to acquire. It's not easy. I mean,
Thank you.
it's a lot of work and a lot of hours of reading. And I would really like to thank you for stopping by and for sharing your wealth of knowledge with us. And
No
thank you
problem.
guys out there in TV, radio, and internet land for spending your Monday evening with us as well. Have a good night and thank you.
good night, everyone.